Hi, everyone. You're listening to Let's Psyconnect. This is LT, and I'm here today with a special guest. We're going to be talking about ADHD. But brief disclaimer here, we're not experts. We're both still students. I'm finishing up my internship, yes, and she's also heading to her internship very soon. But let me introduce you to this special guest. So her name is Kathleen, or she goes by Katie Ramsey, and she's a fourth-year graduate student of clinical psychology at the University of Southern Mississippi, and incoming predoctoral intern at the consortium. Oh, I'm sorry. The consortium is a VA consortium associated with the university over there in Alabama, right?
Yes.
Okay, wonderful. And her interests included the assessment and treatment of neurodevelopmental disorders in children, including ADHD, so attention deficit. I can't say those words because of my accent, but I try my best. So deficit, hyperactivity disorder, autism spectrum disorders, tic disorders, and related comorbidities, including disruptive behavior disorders. So welcome to Let's Psyconnect. I'm really glad to have you on board. Thank you again.
Yeah, I'm excited to be here. And attention deficit hyperactivity disorder is a whole mouthful, so I don't know.
I think I even have difficult saying in Portuguese, so. But I'm really excited to talk about this topic that is, well, there's a lot of conversation about it. I don't think we'll ever know enough. I also don't think we know enough at this time, but we certainly know more than 20 years ago. I think I mentioned to you before when we first met that growing up, it's not something that we commonly heard about it. I grew up in Brazil, and we didn't necessarily talk about it. We didn't even think like people had it or whatnot, or maybe they had it, but the adults really didn't bring it up to the children. So there's a lot of misconceptions and taboo associated with it. So hopefully we can address some of those. And like I said, we're not experts, we're still students, but because of the opportunities that we've had at school and also outside of school, and your interests, you acquire a lot of knowledge on this matter. So I'm glad to hear, I'm looking forward to hearing more about it, what it is that you can share with us today.
Yeah, for sure. Whatever questions you have.
Yeah, so let's get started with let's define ADHD. So what is it?
Okay, so ADHD, attention deficit hyperactivity disorder, is basically a disorder that's characterized by symptoms of inattention or hyperactivity / impulsivity, or both. So usually what you'll see is you need to have at least 6 symptoms of either the inattention or the hyperactivity, impulsivity, or both. And you can have just one or the other. So if you break it down into the subtypes, you can have a predominantly inattentive presentation, which might have been known as ADD back before the DSM-V. You can have primarily hyperactive impulsive presentation, or you can have a combined presentation where you see a nice conglomeration of all those symptoms. What's really important to note about the diagnosis is that you do have to have symptoms pop up before you're 12 years old. That's because it's neurodevelopmental. So they don't come out of nowhere. You're definitely going to have some signs throughout childhood. And they do have to be present in at least 2 different settings. So that can be at home, at school, with peers. So for instance, maybe on a sports team or in different kind of social activities. And then, of course, they have to cause distress or impairment. A lot of the times with this disorder, it ends up being impairment academically or occupationally. It's usually the parents or teachers that are bringing concerns about their kid rather than a kid or adolescent bringing concern about the distress so much. But there's definitely cases of that too.
Well, thank you for the walkthrough over here. You sounded very knowledgeable and competent in this matter so far. It's wonderful. I mean, I don't think I can list them all, but then again, I don't work with children, and I also don't work with, so far, I haven't really seen folks with ADHD. Maybe I've done some testing. I've seen people who came in for tests, and they wanted to know as a rule out and whatnot, but I haven't really provided therapy. So I don't, like I said, I don't have a lot of experience in this matter. But I just want to clarify out there to the folks that maybe are from different countries. So she is referring to DSM-V, which is put together by the American, right, Psychiatry Association. So maybe what you have out there, I don't know if all countries have the same definition or whatnot, but it might differ from country to country in terms of criterion to meet that major criteria for ADHD and whatnot. But then again, we're referring to what's called DSM-5, or referred to as DSM-5, we're abbreviating here. So when we're talking about ADHD, and then I mentioned, I did some testing to rule it out or see if that would be the diagnosis. So what are some, I guess, differential diagnosis?
Yeah, so a lot of stuff you're going to want to look at. Of course, you want to look at any other neurodevelopmental disorder that could be better explaining certain behaviors. So things like autism, things like tic disorders, things like specific learning disability, if we're talking about academic impairment. Other disruptive behavior disorders, so oppositional defiant disorder is another one. Mood and anxiety disorders, so your major depressive disorder, your generalized anxiety disorder, different kinds of intellectual disability, and then there's also some medical concerns that can look a little bit like ADHD. So hearing impairment, if a kid isn't able to hear, even if he has mild hearing impairment, then that's going to make it hard to take in information. Traumatic brain injury can lead to difficulty concentrating or thinking clearly or remembering new information. Thyroid disorders, so hypothyroidism can kind of give you that brain fog sense, and then neurocognitive disorders, so things like dementia can present kind of similarly to ADHD, but you'd be able to capture that by the onset. So remembering that these symptoms pop up in early childhood and not automatically later on in adulthood could be a good red flag for that.
For sure. And you mentioned you put focus on the concentration piece, but some people with brain injury or even the thyroid dysfunction or the dementia part of it, some of those individuals will present with the impulsivity. Right. And so that's another piece of the ADHD diagnosis, or potentially, and then they will be presented with more like compulsive side. This is something to pay attention to. And you did mention some other diagnoses that will be under the DSM-5, like, the disruptive behavior disorders, oppositional defiant, and then again, it's all behaviors, and it's really hard sometimes because when they come in to see the professional, they might behave in a certain way, whereas in those two other settings that you mentioned, they present it differently. But like it's almost like sometimes when they see somebody new, they tend to behave like, oh, I'm gonna be quiet now, whereas other people or kids, you will see it right away, like they start moving around, they'll be the same thing, that there won't be it won't matter what context they're in. So hearing the report from the parents or the teachers can go a long way.
Yeah, absolutely. Like you said, there have definitely been times where I've tested kids, and under those kind of strict testing conditions, you'll see some of that, fidgeting or the careless mistakes or things like that. But for others, especially for girls, I found a lot of the times they're very, concerned with following the rules, and they have these kind of perfectionistic tendencies. And so it's definitely helpful to get that collateral for anybody that might, spend a lot of time with them and see them in different activities that are less structured versus more structured, to get an idea of what they are like generally, because picking that up in a 2 to 4 hour testing period isn't going to capture their whole life.
Yeah. I wish we could just go and, there and just sit around. Sometimes some professionals do have the flexibility and can actually just observe the patients, or those individuals. But a lot of us, we can't do that, unfortunately, when we can't have a camera, looking at their behavior all day long. But it would be a nice way to collect the data, right? So that we have more information, for sure. Maybe in another world.
Which is also why school observations are really fun.
Yeah.
Wall.
I think I would have fun doing that, but then again, I just work with adults. One question, so what causes it?
A lot of different things have been hypothesized to cause it. So I think the main thing that we have the most evidence for is just the heritability of the disorder. So it's really, really heritable. So if you have a first degree biological relative with ADHD, like your parents, your siblings, that increases your odds of having it. Some other things we know are risk factors are things like preterm birth, very low birth weight, smoking during pregnancy, which those things kind of go together. So if you smoke during pregnancy, you're more likely to have low birth weight. If you're preterm, you're more likely to have low birth weight. And then lead exposure is another thing that we know has been possibly tied to it. But as far as, I feel like we know a lot more of what doesn't cause ADHD. So sugar doesn't cause ADHD. Bad parenting, quote unquote, not effective enough discipline doesn't cause ADHD. The one thing we know that's tried and true is that it's very heritable.
Yeah, because I do hear a lot that, whenever my child drinks soda, plays, eats this and that, and then he becomes, I don't know, distracted and hyper, but it doesn't cause, because it's not consistent throughout, right? Maybe it's just like 1 hour range while the body is, I guess, digesting that food. Yeah, it might increase energy levels and whatnot, but unless the person is drinking soda for morning, I don't know, breakfast, lunch, and dinner, which is possible. We definitely need to rule that out too.
Yeah, for sure. Wouldn't want that, but that is just a snippet of the day. And this, ADHD is something that's really persistent.
Yeah. Do you know much? And it's okay if you say you don't know. Do you know much about the nutritional factors associated with ADHD though? Like for treatment, for instance, if you do continue to provide your child or the adult with sugar, type of food versus maybe fruits also have sugar though, or what would consider like healthier with like seeds and more whole grains and whatnot, if there's a difference?
So kind of yes and no. And I'll preface that by saying I don't know very much depth on the research, but what we do know is diet affects a lot of different things for a lot of different people. So it's not specific to ADHD necessarily. So while one kid with ADHD might do well with less processed foods, less sugars, things like that, another kid without ADHD probably would as well. So I don't think it's unique to ADHD so much, and there's not evidence that suggests diet is a good treatment, but I mean, it's absolutely a good idea to, incorporate a healthy diet as much as possible, especially for kids with ADHD, because they're possibly at risk of, more compulsive eating behaviors. And so I think that's a good habit to build in anyways.
Yeah. And do you think schools are more now equipped, I guess, to be on the lookout for possible presentations of ADHD-like symptoms?
I do think so, yes. I think that's one of the reasons that diagnoses have gone up over the years. So if we look at, diagnoses for a lot of neurodevelopmental disorders, so ADHD and autism come to mind specifically. The diagnosis rates have increased over the last decade or so, not because more kids have these disorders, but just we have better tools to identify. There's, pediatricians are screening, teachers are referring kids for testing. And so people just have a better, peeled eye when it comes to these things, which is really exciting. That means more kids are getting treatment early.
But then we hear a lot, and tell me if it's a myth or there's some truth to that myth or whatnot, that kids are overdiagnosed with ADHD here in this country versus in different countries. Can you speak about it?
Sure. So that's such a tricky subject. So if we are looking at rates of diagnoses, definitely in the US, kids are diagnosed more often than in other countries with ADHD. So we have the highest diagnostic rates in terms of that. For adults, though, the highest diagnosis rates are actually in France, I think. So there's a little bit of variability. It's really interesting looking into this. But you're right that the rates of diagnosis are a lot lower in certain countries. So especially if we think of Iraq or Romania, a lot of those countries have lower rates. And so the important thing to keep in mind is we do have really solid evidence that ADHD exists. So it's not a question of that. It's more so, how is this popping up in the context of differences culturally? What kind of access do we have for diagnostic impressions to be made? What kind of tools are available? And I know you mentioned, in your experience, when you were growing up, there wasn't a whole lot of talk about ADHD. I'd be really curious to kind of hear about what your experience was and, you know, maybe how that kind of shaped your thoughts regarding the disorder growing up.
It's just, I didn't know much about it. I can possibly think of one person maybe in my school, you know, or I guess my grade level anyways, you know, it's not like I knew everyone in my school who could maybe be diagnosed with it, but then I don't really know. I mean, this person got good grades, you know, and didn't get in trouble at all. And then so, because I know that there's also the idea that folks with ADHD, they also don't do as well in school as those who don't have the diagnosis because of the difficulties with concentration and also the impulsivity if they do present with the hyper level too. You know, but as far as I know, this person got really good grades. So I don't know, or maybe it was just the style, the teaching style maybe didn't fit in with that person. And then when she went home or he went home, you know, it clicked well, got the books, was good to go. I don't know. But and when I moved here or learned more about it, it's just like, we don't have that, you know. I mean, I'm sure we had that back then, you know, it's been a few years anyways. But I think it was just more of like a myth, you know, like, oh, who has that, you know, versus like, well, I went to school with like so many students and we didn't have anyone with it or no one talked about it. It's not like people also promote like, hey, I have this, you know. So the idea of it, like how many people actually have it and they also being treated with medication as an early age, it was scary to me at first, but mostly because of the lack of knowledge and understanding of it. And also because I didn't know if there are other things that could be done to help the child, you know, to maybe learn some coping skills, or if it was something that was happening at home, you know, like try to change the environment so that the person benefits from it. So like I said, like lack of knowledge about it. But now I know a little bit more. Like I said, not an expert in it. Don't think I will be.
No, that totally makes sense. And I like what you said about, you know, trying to kind of change your environment and your learning styles and how you go about treating it without medication. Because what we do know is that medication and psychosocial treatments are equally as effective. Paired together, you kind of get the most bang for your buck. But there's, you know, certainly parents or, you know, adults with ADHD who might choose to get, you know, more of that therapeutic kind of intervention as opposed to medication, or at least trying to start with that and see where that leaves them. For other kids who are so severe where their baseline is up here and it's need to bring them down here so that they can benefit from the treatment at all. That's when medication is definitely a good fit. I think I went on a huge tangent. To answer your question about if it is more diagnosed than it should be, I just totally glazed over that. I think the evidence says no, but I will say I 100% understand how people would think that, because anecdotally in my own experiences, I've come across numerous kids and adults who have been given diagnoses, and you look at the data and it's just screener level kind of data. So it's not really a comprehensive picture. And a lot of times these people just have a lot more going on that much better captures those symptoms, because it's not unique to ADHD alone, and they can look at a whole lot of other stuff. So I think we're getting better at capturing that, but I'm sure that there's tons of cases in which people are diagnosed with just insufficient evidence.
Yes. And you know, the other myth, I guess, is like people think that it goes away. And if you're not having that as an adult, does it mean that maybe you didn't have it as a child, you know, or maybe it was like an environmental situational thing, you know? So tell me more about it. Like, does it go away? Does it not?
So that's another tricky question. ADHD is so tricky, which is why I like it so much. So what we do know is that kids who have ADHD are pretty likely to have symptoms persist throughout adolescence, and about half of them have those symptoms persist into adulthood. doesn't necessarily mean it goes away entirely or that you never had it. I think what usually happens is they're either receiving treatment or they're learning ways to kind of navigate their ADHD in a way that works for them. So their symptoms just aren't as impairing or distressing, and they're not so clearly present. The other thing that happens too is once you get into adulthood, those symptoms kind of shift in their presentation. And so you can see changes there too. And so for some people, while it may, stay the same or potentially spike up more, for other people, they might kind of just get into the groove of things, figure out styles that work for them, and learn to navigate, the world around them in a way that's just more adaptive for them. So doesn't go away, but they might not meet diagnostic criteria anymore.
Yeah, I've met people through life when they said, "Oh, I must be ADHD." I'm like, I don't know. Don't ask me to diagnose you. You're not my patient, and I don't have enough information. But they say that, oh, when I was a child, it was like X, Y, and Z, and now I can do things differently. I'm like, but maybe you did have, maybe you didn't, but I also don't want to reinforce the idea that it's okay to just label yourself or use ADHD as an adjective, or just like put the word out there, and also contribute to erroneous thinking of the diagnosis,
Right. ADHD isn't, the characteristic you see on the cartoon. Somebody's like, oh, look, a squirrel, and it's funny and it's ditzy and it's silly. And ADHD is really impairing, and it's something that's, a lot of people, show in a very light comical tone, but it can actually be, pretty serious. And so I totally agree that, taking that out of our vocabulary as an adjective is really important.
Yeah.
It's not. It's definitely something that should be, looked at with a more serious eye.
Yes, for sure. I have another question for you. So is there a difference between, for instance, if we just think about the binary system here, between how male and females, in terms of the diagnosis?
Yes. So I think I mentioned a little bit earlier that in my experience, and I think for a lot of other people, girls can present in that more perfectionistic way. And so kind of a segue into that, what we know from research is males are a whole lot more likely to receive a diagnosis of ADHD in the first place compared to females. So again, we're talking about the binary assigned male at birth versus assigned female at birth. And, this is pretty consistent across, parents. So whenever parents are looking at their kids' behaviors, a lot of the times they'll, kind of suppress ratings regarding hyperactivity, impulsivity for girls versus boys. They'll actually amp those up a little bit. That's because boys tend to be more externalizing. So they're doing a lot more observable behavior. So out of seat behavior. They have, more potentially aggression, more acting out, blurting out answers, interrupting. And so you can visibly see it. The teachers see it. It's a lot of the times it can annoy others. It can bother others. And so they want to fix it. And so that's why these kids get sent in for testing. Girls, on the other hand, a lot of the times are more internalizing with their symptoms. So, they might even appear more quiet. They might seem kind of spacey. They might seem to themselves, zoning out, that kind of behavior. I think a lot of people would describe this maybe as the more sluggish cognitive tempo type of ADHD that there's a lot of research on lately. But that's why a lot of them are underdiagnosed.
I see.
Yeah, and even for the girls who present with those hyperactive impulsive symptoms, they might be viewed as, chatty and conversational and just, boisterous in the most positive way. It's not seen as something that's, bothersome to other people. So even though it's distressing for them and it might impede on their ability to do things the way they would like to do, since it isn't bothering anyone else, it's not typically seen as a problem. And then on top of that, like I mentioned, a lot of girls can tend to kind of mask their ADHD in a sense. So they develop these kind of compensatory strategies and really try to over succeed and make sure that they're pleasing everybody. And so that's kind of the big difference between males and females.
And it sounds like, boys, then they get more attention from their teachers. And I think there are different studies, even in social psychology field, and the boys don't necessarily have ADHD diagnosis, but I think overall, you know, because of the behaviors or the expectations that we have on boys versus girls, teachers place more attention on boys, at least within a certain age group, and then eventually it gets even out a little bit more. But with that too, because a lot of the behaviors that the boys present can be associated with disruption, right? And if they're going to get in trouble, so there's the tension, which can lead to a whole different set of problems, right? Because they're not getting the right type of attention that will lead to improvement in their behavior.
Right, exactly. And I think another thing too is not only are boys getting diagnosed more than girls, but they get diagnosed earlier a lot of the times, because boy symptoms tend to really jack up in childhood, and girls tend to experience increased symptoms once they reach adolescence, on top of a host of other comorbidities. And so, you know, it's up until that point when maybe their, you know, social or academic, you know, loads have just become too much for them to compensate for. So there's that big difference in the time in which they're actually getting diagnosed and getting treatment. And so that leads to different outcomes too.
And so we're talking about gender, and I know you mentioned some countries too in terms of diagnosis and rate within those countries and whatnot, even though we didn't get the numbers necessarily, but it's fine. We can post them if people want to know the numbers per se, and also the resource information. So if you want to know the specific numbers, guys, just or ladies, you can also reach out to me. Go to connect@letspsyconnect.com. But I just want to ask you if you know of like racial and ethnic differences.
Yeah, so there's differences in terms of race and ethnicity too. So one thing that we know is that white adults have the highest rates of ADHD compared to other races. So if we're looking at Asian and Native Hawaiian or other Pacific Islander adults, they have the lowest rates. Hispanic children are a lot less likely to be diagnosed with ADHD compared to white children. So it's something like 35% less likely. And then Black children are about 69% less likely than white children to receive an ADHD diagnosis. So, I mean, there's a huge discrepancy between all of these different groups, and, you know, how they're not even being identified in the first place. And this is for a lot of reasons, you know, supposedly. So we don't know for sure, of course, but there's hypotheses about how, you know, there can be differences in access to treatment, or just, you know, differential rates of treatment seeking in the first place, differences in how we detect ADHD symptoms and attribute them to different problems. So one huge thing is a lot of Black children will get pegged as being oppositional defiant instead of being hyper impulsive, which it could be both. Like, those things are highly comorbid, but a lot of times they immediately jump and put that label on these children instead of, you know, examining the whole profile and, you know, what their environment is and what kind of, you know, symptoms they actually have broken down more. So that's a huge problem. A lot of kids in minority groups might just be less likely to get referred by school professionals, so like their teachers. And then, of course, there's, you know, cultural influences on how ADHD can be expressed or manifested too. So there's a lot at play here, but white children and white adults are most likely to get diagnosed and treated for ADHD.
Yeah, and also what you mentioned earlier, right? It might be hereditary, so there might be a genetic component to it, you know, or something that's activated or whatnot. So maybe it's more common among white because of the genetic component versus in others. And I like that you added the part of the cultural, and like what might be accepted in one community might not be accepted in another. And also what is part of one community and not seen necessarily as ADHD, but seen as negative, like, you know, people being labeled as lazy or just disruptive, like just don't care enough.
I was listening to another podcast recently, I think, and there was this description about how ADHD is very much, if you think about it in the context of our modern day society, where we're sitting in class for 8 hours and then we have our computers in front of us all day, and we're constantly plugged into stuff, and that's kind of not what we were evolved to do necessarily. And so if we take all of that out of the equation, would ADHD be all that maladaptive? I don't know.
Yeah. And I was talking about that with someone recently too, like, not the school system, the general one is not necessarily good or fit for everyone out there. And there are different teaching approaches, right, or learning approaches that benefits other people, or those who sometimes get stuck in the system because that's how the parents want, or that's what the system wants for them, whatever, could definitely benefit from other school environments that have more flexibility, or even homeschooling too, that might be able to offer some flexible work schedule now, school schedule, which is also a lot of work anyway.
Yeah, it is. There's a lot of just systematic things you have to, hoops and ladders you have to jump through. But you're totally right that I think flexibility is kind of the key word here, and that, when you're thinking about accommodations for these kids, we have to think about what's going to work for them. Having ADHD itself, while it's real and it's impairing, that alone isn't the problem. It's how it's impacting their ability to succeed in different areas of their lives. And so, if a kid is really restless and fidgety, letting him stand up to do his work might be a good thing to do for that, because it's not going to impede on other kids' ability to do their work. And it's going to help him kind of get the wiggles out. And so little flexible things like that can really be helpful for kids and for adults in the workplace too, just navigating how their ADHD can fit in, in the schools or in the workplace.
For sure. Like the whole idea that we always have to be sitting and can't move in a meeting or a session, I don't know where that came from. I wonder now, but a lot of studies have shown, it's not even necessarily for ADHD, but if you're tired or you spend the whole day sitting around, and then you go to class in the evening, then you have to sit, you benefit from standing, right? It's good for your health in general. So I know some professors are okay with you standing, go to the back of the classroom, because also you don't block the view, right? but stand in the back of the classroom. It would be really nice if you had those flexible desks too, that allows you to stand and do some schoolwork while you're in class. But I think that's in the future, a long future, because they're very costly.
I think fingers crossed we have more funding for academic. My brain just exploded for the academic.
That's okay. Yeah. One more thing that I want to talk about. I know we mentioned some myths here and there, and we're sort of alluding to the environmental factors, but sometimes we blame the parents or society in general, not necessarily we in terms of mental health professionals, but maybe some mental health professionals do it too. Or you are not parenting your child adequately or sufficiently, reinforcing or punishing behaviors and whatnot. So is ADHD a result of bad parenting, if we can call that? I hate that we call that.
I know. I know what you're referring to, though, and everybody else does. So it captures that. No, it does not cause ADHD. It can, however, maintain symptoms or exacerbate them. So the tricky thing is we are not given a manual when we have kids. Nobody gives you a parenting manual that says, here's all the perfect ways to do things. And even if that was available, it wouldn't work for every single kid, because every kid's different. So I think that, placing the blame on the parents is absolutely just counterintuitive to what we want to do. But there are parent management strategies that we can teach parents so that they can, increase the likelihood of their kids doing things that are adaptive and functional, and decrease the likelihood of them engaging in behaviors that aren't helpful for themselves or for other people. And just supporting parents and learning those skills, because again, nobody's taught those, and they're not natural skills. They, we aren't proud of them. So, they're evidence-based, they're helpful. And they can definitely improve certain behaviors associated with ADHD, but not having those skills does not cause ADHD.
Yeah, yeah. Thank you for saying that, and like you said, we don't necessarily come up with a manual, and then the manual would probably be a sequence long manual because, hey, if your kid presents with X behavior, then do this, or
Yeah.
do X, Y, and Z to prevent another behavior. And everything we know it's probability anyways. We don't have a lot of information in cause and effect, unfortunately. There's more to be learned for sure, maybe in the future, and I don't know if you're going to be around to know that much. I know there's hope, and I just think what I hear is that for treatment, the family, right, parents or supporters, teachers, those involved in the care of the child, are welcome in the therapy, I guess, session or therapy environment, or should be receiving some type of education on the matter, not just ADHD, but in raising the kids in general.
I think everybody should have access to parent management training for free, without any
Yeah.
but that's not how our system works, unfortunately.
And get refreshers, right?
Yeah, they're hard to learn, and they take so much practice and repetition and generalization to other areas outside the home. So
Yeah.
it makes sense why they wouldn't be intuitive for people just automatically, and why they need to be taught.
Yeah. Well, the good thing is that there's hope. There's a lot of hope. Research is providing us with a lot of information, and people's experiences are providing us with a lot of information on the care of those with ADHD, let it be a child or let it be an adult, and how to best foster an environment for their growth and well-being, and to help them succeed, right? Because we want people to succeed in life, however that success might be defined for them anyways. I just want to thank you so much for being here, Psyconnecting with me today. This has been wonderful. I really like talking about this topic today. Can't wait to hear what it is that people are going to think about this, or their emotional reactions about this too.
Yeah, for sure. First time ever to be on, so we'll see how it goes.
Good. Good. How can people, I guess, connect with you if they desire to?
So I am on Twitter. I don't tweet a whole lot, but I sure do like liking other people's things. So it's a KL Ramsey Psych. So RAMSEY is Ramsey, and then Psych is PSYCH. Nice psychology abbreviation. My email address, I'm assuming I'll have for the next year, since I'm still going to be technically a student on internship, and it's
you should.
and it's kathleen.ramsey@usm.edu. So should be able to reach out to me for the next year before I'm disconnected from their email.
I think you're gonna be connected for the rest of your life now, as far as I know, but don't quote me on that.
Stop checking it, I guess, is the right.
Yeah. I mean, maybe we'll stop getting the, you won't have the need to check it out anymore. But but thank you again. I'm here for you if you need anything else in the future too, because you're going through a journey that I just went through. Well, I'm still going through, but I'll be done soon. And you'll be then thinking about postdoc and whatnot. So that's the whole point. We're Psyconnecting, and we're building support for each other in this community, right? Mental health professionals community here. So thank you again. And I will write down your Twitter handle and your email address when I post this on the Let's Psyconnect Instagram page, as well as the YouTube page. And you all, if you're not watching this, you can watch it on the Instagram IDTV page of Let's Psyconnect, or like I said, on YouTube as well. If you don't know the link to all those things, just go to www.letspsyconnect.com. And if you want to Psyconnect with me, send me an email over connect@letspsyconnect.com. And remember, Let's Psyconnect.